One of the things that I really encourage you to do if you want to avoid having an episiotomy is to actually have the conversation with your doctor at your 36, 37, or 38-week appointments. It's not the conversation you want to be having when you're in labor, because you're in labor and you're really, really vulnerable. And it's important that you go into labor feeling confident that your doctor is actually going to support your wishes to not do a routine episiotomy, and to help you and work with you to support your pelvic and perineal area during labor and birth. So the kind of questions you want to ask when you go into that conversation with her is that actually knowing what is their practice regarding episiotomy, because despite the research, there are still many doctors who practice routine episiotomy. And I'm going to share a document with you where you will see that that dates back to 100 years ago, and the research clearly shows that there's only 2 reasons that an episiotomy should be done. You want to be able to show them and give them that research, and that is available for you. You'd also like to know if there's any hospital policies regarding episiotomy, and if there are, you want to see them, and you have every right to see them. You want to know if they would ask for your consent if they were going to perform an episiotomy, and it is an invasive procedure. So in other words, they do need to ask for your consent. However, it's important for you to note that once again, once you're in labor, it's an incredibly vulnerable time. And when the episiotomy is done, is just before crowning, when you are very deep in labor. So it is not the conversation you want to have, but you do want to know and feel confident that your consent will be asked for, and that you and your partner are aligned with that in the event of it happening. You would like to know if they routinely use local anesthetic when they do an episiotomy. Now, I'm going to cover the use of local anesthetic in another video. Once you've watched that video, you will understand why I'm bringing that up, and it's important that you're able to converse and have that conversation with them. You also want to know if they would be comfortable assisting you if you were not in your bed. So this goes to positioning in labor, and you'll be learning about that in other modules of the course. Would you feel comfortable if you were in a position that is not the traditional in bed on your back, which is when they have the most access to and the most visuals, and which is very often when they do an episiotomy. So the positioning is important, and their comfort level with you being an active participant is an important aspect of you being able to avoid an episiotomy, because your positioning will allow more comfort, space, and room, and will be allowing you to use the other breathing techniques that you will learn about, that is going to guide and assist you to support the perineum and to be able to work gently breathing your baby out. And then a big one, which will also be covered in a separate video, is asking whether or not there is directed pushing and guided or purple pushing, which is an important factor to consider, because it's very often when there is purple pushing and guided coached pushing when an episiotomy is done, because there's a lot of time pressure. They're watching, they're waiting. It's push, 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 push. And if things aren't going as quickly as what they think they need to be doing, then an episiotomy is done almost to speed up the process. And very often you are actually happy because you're also exhausted, because you've been pushing so hard and so long. So there is an element of exhaustion, and there's an element of, yes, actually, this is going to help me and it's okay. But if the purple pushing wasn't done, it wouldn't have been required. So it's also about making sure that the practices that are done in the hospital are going to support your preparation and your ability, and the things that you can do to protect your pelvic floor and to prevent an unnecessary episiotomy and any extensive tearing.